Welcome back to Holistic Healing Association. I'm Erin D'Arcy. I'm certified in embodied processing and clinical hypnosis. Today, we have Dr. Bradshaw. Thank you so much for joining us. And would you like to tell us a little bit about yourself and your practice?
Yes, thank you, Erin. It's good to be here. Well, so I'm a psychotherapist based out of Tucson, Arizona, and I hold a PhD in clinical psychology. My therapy practice, I call it fully human psychology. And it's really this idea that part of why we're here as humans is to be and become fully human, to access our full range of strengths, to be able to live according to our conscience and in a fulfilled way, and to be able to heal and integrate wounds and overcome things that hold us back. I'm grounded really in existential humanistic therapy and somatic experiencing. I'm a somatic experiencing practitioner, and in existential humanistic therapy, I'm trained at the advanced level by the Existential Humanistic Institute. I'm also assist with teaching there. And I do incorporate a lot of dream work into my practice. Not with every client every time, but I do incorporate it, and I have for a while now. And I can disclose that as an adult, I'm in Jungian therapy myself, Jungian analysis myself. So I
Okay.
received that type of therapy that focuses a lot on dreams. And yeah, and in my
Oh,
therapy practice, I also integrate some EMDR. Not that often, but in certain cases, for certain reasons, I do. So yeah.
okay. And what is existential humanistic psychotherapy? Can you
Yeah.
explain it to everyone?
Yeah, I can. And I I was thinking about it. I think I can explain it succinctly two different ways. I think might be the best way. So one way is a mentor of mine, Kirk Schneider, who's a great writer, and he writes about things like awe, the experience of awe, AWE, and different things. Um, he likes to say that EH therapy asks two questions and can ask them in a kind of implicit or an embodied way. But two questions: how am I presently living my life right now in this moment? How am I living my life? I've been given this life. How am I living it? And how am I willing to live it? And those within that, existential humanistic therapy is really an integration of two forms of therapy, existential and humanistic. Existential looks a lot at, I'm going to give a very kind of pointed example. Let a kind of a real world example as a way of explaining this, so I don't get too abstract and theoretical. Um, the Surgeon General under Biden came out with a report on the loneliness epidemic, right? And he talked about how loneliness can be linked to negative physical health outcomes, that it's a stress on the body as well as the mind and the behaviors and everything. And in existential therapy, we talk about these givens of existence. So, this idea that all human beings, whether we're always conscious of it or not, have to grapple with certain things like life and death, isolation and connection, meaningfulness and meaninglessness, or mystery, um, and freedom and limits, or freedom and responsibility. That they're explained different ways, but so when we think of loneliness, existential therapists point out with the given of existence I refer to as isolation. Existential therapists think of things in terms of, am I isolated in any way from other humans? So interpersonally, am I isolated in any way? Intrapersonally, am am I isolated from myself? Am I cut off from aspects of myself? And then they talk about existential isolation. So existential isolation is basically the idea that there's a certain amount of aloneness that we all have that can't really be cured. We can distract ourselves from it, but all we usually have to do is sit with ourselves quietly in a room for a little while and not be looking at a screen or not be reading or not be productive or not be daydreaming necessarily, but kind of noticing ourselves and our bodies sitting in the room, maybe not even necessarily meditating, because that's also doing something. There's something that happens, and an existential therapist, when I look at what's going on with a client, I don't only look at mental health disorders, I look at what is their relationship to death, to meaning, to isolation, to freedom. And that's sort of how I conceptualize cases. The idea that we all have to face those and we have to make something meaningful out of them. The humanistic piece brings in ideas from folks like Carl Rogers, Abraham Maslow, other people, Karen Horney, which not a lot of people know about her. And it's basically the idea that we have needs as humans. We have needs for growth. We have needs for security. We have needs for transcendence and peak experiences. We have needs for love and exploration. We have these needs. Maybe they could be broken down to growth and security needs. And they can never be perfectly met, or all of them can't be perfectly met for very long. But we need to have them as met as possible. As society, we need to help each other meet our needs as much as possible. And as individuals, we have to make efforts. And when we're struggling, it's often because of a need that's undermet. But humans are naturally oriented. We're always trying to figure out how to get those needs met, and sometimes in not the best of ways.
Makes sense.
But so EH therapy kind of combines those two, and it's in terms of how the therapy works is a whole other story, but that's kind of the philosophy behind it. It's yeah.
Okay. Okay,
Yeah.
thank you. And what does it mean to be fully human?
Yeah, it's a big question. I want to answer it, but I also actually want to hear what you think about that question.
Be fully human?
Like, what does it come up for you? Yeah.
That is a big question. Well, I believe personally that healing includes mind, body, and soul.
Yeah.
And I agree with you. We have to look at all aspects of ourselves. And I believe, just from what you were saying, human connection, community is really important. So that is a need we need. Every person needs community, fellowship, love, acceptance.
Yeah.
These are some core basics needs. So if we're looking at if we are fully human, is to be our authentic selves.
Yeah.
And often when we have trauma, particularly when we have development of trauma, it can be difficult to know our core authentic selves. Because of our trauma, there can be multiple layers on top of our core self, our soul. And when we're doing our healing work and we're exploring and we're taking down the layers like an onion, And that's what healing is. We can start to find ourselves, our authentic self. And that's when we attract our people.
Mm. Mm. Yeah, that's beautiful.
Thank you. Yes, I've
I
never
would
been
agree.
asked that. I threw that question out for you, but yes, thank you for asking.
Yeah, yeah, I was I with a colleague of mine, Sophie, we have a podcast where we ask all the guests that question.
Okay,
And and then we tend to title the episodes based on kind of a phrase in their answer that kind of stands out. So some of the answers people have given was, to be fully human involves the capacity to be deeply moved. Like, can you be deeply moved by things? Another person had said I think she said a evolving a curiosity for the evolving possibilities of our lives. Another person said an ethic of radical hospitality.
okay,
Yeah,
interesting.
so people have come up with some cool things.
Yeah,
Yeah, I mean, I think for me, it's kind of, can I access my full range of strengths and capacities? Um, can I can I experience my can I experience my life in the present moment? Um, can I act aligned with my deeper conscience? Not, but it gets a little tricky because of the layers of things you mentioned, like, um, one of my self protections or defense mechanisms that I developed after some trauma was kind of like a perfectionism towards myself, or like a rigid kind of uh I'm never good enough type thing, you
that's
know?
me.
Yeah, yeah. So
Yeah,
the I think that can cut me off from being fully human, because part of being human, and this goes back to the existential idea too, of part of being human is we do have limits, right? Like we're not perfect, and um sometimes a lot of good can come from us not being perfect. And
true.
it's like when I'm working in therapy with people, it's kind of good that I don't have all the answers, and that I know I don't have all the answers, because ultimately I want the client to find their right answers too.
Yeah, no, I like that
So
because it's
yeah,
true. Not one person on this earth is perfect. We
right,
all have struggles, and that is also what makes us fully human,
right.
right?
Yes, exactly. It's not about being confident and happy and positive all the time necessarily. I mean, you know, um, yeah, I know there's folks, sometimes, Abraham Maslow, who came up with, the pyramid is associated with him. Um, and have you ever heard of that? The hierarchy of needs?
I believe so, yes.
Yeah. Well, it's interesting that it turns out that he never created the pyramid, and he didn't like it.
Okay,
It was like a business consultant created that based on an interpretation of Maslow's ideas.
okay.
But part of what Maslow didn't like about it, it ties into what you and I are talking about, is that Maslow felt like life, even at its best, is two steps forward, one step back. That, like, what he didn't like about the pyramid is it implied your physiological needs are at the base,
Mhm.
and then you have like a need for self-esteem, a need for connection, and then self-actualization, which is self-actualization is it's basically just you contributing what is uniquely you to the world, whatever that is. and for the benefit of other people and yourself. Right.
Mhm.
So, but he didn't see it as this hierarchical thing. Like he didn't see physiological needs as lower. It's like, and none of those, often things come up in life where needs are not perfectly met. Like, so he didn't believe that your physiology had to be perfect before you could contribute what's uniquely you, or that you have to be perfectly healed, or that your self-esteem has to be like permanently perfect.
Mhm.
Is like that's not, he saw it
No,
as
it's
more of
we all stumble, right? And
this
it goes,
fluid
and
thing.
it's true because
Yeah,
life is like
yeah,
this, right? It goes up and down.
yeah,
Like,
yeah,
I mean, ideally it's like this, but it's not.
yeah,
But it
yeah,
goes up or it goes down, and then it can stay stable for a little bit, and then it goes up a little bit, and then stays stable, and then goes down a little
yeah,
bit. It's
yeah.
not just straight up. Even our
Right.
healing journey, as on our healing journey,
Mm-hmm.
some days we're going to hurt more than others, and some days are going
Yeah,
to be easier. So it makes sense why he wouldn't like the pyramid.
yeah. Because and then what ends up happening sometimes, because I worked for busy agencies for a long time in mental health, and sometimes the pyramid just gets reduced to, um, you can't help a client with their trauma if they're homeless, or you can't help a client with their addiction if they're homeless, or you can't really do deep therapy with someone if they have financial precarity. Um, but my experience was it's people aren't that, it's not that simple. It's like, yes, I try to help them get their basic needs met, of course, and I try to refer them because obviously that's going to be a big stressor
Mhm.
for most people, not everyone. I've had clients who've chosen to be homeless for periods of time. Um, but you can work on things kind of concurrently. You kind of, in therapy and anyway, you kind of can't help but work on things concurrently. So
Exactly.
his pyramid was taken in a way to be overly rigid, and um I think mostly out of the anxiety of practitioners sometimes, where it's like, oh my gosh, I can't do anything except this. And but I try to follow the lead of the client, and then but yeah, so it's a fluid process. I think being fully human, being and becoming fully human is a never ending process as far as I'm concerned. It's not like a, I'm skeptical of anyone who says they've completed it and now they are it.
And they're fully
I'm
healed
highly,
and
highly
everything's
skeptical.
perfect and everything's
Yeah.
great. Like it's a
Yeah.
journey, right? And as
Yeah.
we are on this journey, we discover ourselves deeper and
Yeah.
deeper. And starting this journey, our healing journey, helps us discover our authentic self. And why is it so important to find meaning and purpose in our life?
Yeah. My take on that is that it's built into humans to orient towards meaningfulness and purpose. Um, it can definitely get hijacked though. Like, someone could have a purpose in life to be the most ruthless dictator of all time. I mean, so purpose can get hijacked by evil or by different things, um, self-protective patterns,
Mhm.
narcissism, or can get hijacked. But um, I kind of believe, I ask myself, it seems to me like there's no other species that could push a button and destroy all of life on Earth or behave like saints. Like we're not the biggest, we're not the strongest, we're not the fastest. I don't think we're the most special, I think every being is equally special, but I
Mhm.
also think every being has a role to play.
Mhm.
And it seems like part of our role as humans, given that range of power that we have,
Mhm.
because we're not the biggest, we're not the fastest, we're not the fiercest, we're probably, I don't know, I mean, we have the biggest brain, but we we could literally destroy all life on earth, or we can be these altruistic saints. So it seems to me like that means we're meant to be stewards of some kind. Like we're meant to
I believe
be,
so.
yeah, like
Help.
we have a service orientation, and that doesn't mean we shouldn't kill an animal if it's trying to kill us, but it means nonetheless. So meaning and purpose, I think, is how we orient. Like, well, meaning, how do I make meaning out of my suffering? Um, if I'm an employer and I have a choice to make, like, well, I could make 3 million a year and I could squeeze my employees, strangle my employees, or I could make 1 million a year and really help them thrive. Um, I have a choice to make, or I'm a supervisor and I have a employee that makes me feel threatened. Uh, like they feel like they're a little smarter than me, and I don't like that. Um, that's a suffering I'm having. How am I going to make meaning out of that in a way of, well, I have more power, so I could sabotage them? Or am I going to make meaning out of it of maybe being part of a leader is having the courage to let someone else shine, and maybe I have a purpose of being a leader that helps people grow. I think humans have that power. We don't only have to do, I mean, and I'm sure other species have this as well, but we have it with a big, high stakes. We have a lot of firepower. It means a lot when we start going the wrong direction. It means a lot for all the other species.
It does. And I believe
Yeah.
with leadership, a true leader looks at everyone who is following them
Mm.
and looks at how they can help them. It's
Yeah.
not about me.
Yeah.
It's about looking back at them. If they are following, how can we help? Right?
Yeah.
What is at their best interest? Not ours, but theirs.
Yeah.
And personally, I also believe that we're all born with a purpose.
Mm-hmm. Mm-hmm.
Eastern, Western religions, I believe all have that we're all born with a purpose in life. And to discover our purpose may help us become our authentic self and also give us a sense of peace.
Yeah, I agree. I resonate with that. Yeah. Yeah. And that's a choice, right? That you mentioned with the leader there. That's a meaning, because the leader could make a different meaning. They could make a meaning, they're lucky to work for me and I'm the center of attention. That's a different meaning, right?
Exactly.
So there's a choice that we can make that can be hard to make. I mean, if I'm being real, sometimes your ego has a reaction,
Yes.
right? And next thing you know, you're automatically, and you're like, wait, what am I doing? I don't, yeah.
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 I agree. I agree. And why is it so important to explore our own beliefs and values?
Yeah. Right. And that ends up happening a lot in therapy, explore beliefs and values. Well, I think that they guide us, or sometimes they're guiding us unconsciously, or sometimes we feel like we're never living up to them. And I feel like values, let's say, can be sources of great inspiration and motivation, and they can also be sources of great discouragement, because it's like never perfectly live up to this,
Right.
so if we've surrounded the value with this rigid perfectionism, um, it may not be the value that needs to change. It's how we are working with the value and what is it doing to our body and our emotions and our relationships with ourselves and with, and so beliefs can get really, the a lot of forms of therapy have this idea that part of what causes human suffering is unconscious or semi-conscious negative beliefs about self, others, world, often started with trauma or neglect or some type of societal standard, or it could be a lot of different things, a genetic factor, but
Genetic, that I did not know.
yeah, yeah, like
Interesting. Our beliefs can come
yeah,
from genetics.
yeah, I think so. In terms of, well, one way that I think that can happen is we can be genetically predisposed to worry a lot,
Okay.
you know, or to be impulsive, right? Like those are two things. So being impulsive and worrying, both of which are not always bad.
Mhm.
They're pretty stigmatized because for various reasons, but um if you think of like worry in and of itself, separate from trauma, I mean, maybe there was trauma down the line, but ancestral trauma, but kind of worry, there's a message in worry. Like, I guess a basic one might be things might not go okay.
Mhm.
Like, so that could be a belief that I generally believe if I'm a person that worries a lot consistently, you know, um, there may be this consistent belief of things may not or probably not going to go okay,
Okay.
and that could be, you know, it may not be able to be changed, but it can be danced with differently.
Right.
Like what is it? How do you move with that? So so you're a person that tends to, that's how, things, you're always thinking about what could go wrong, and
Mhm.
um, some studies have shown that people that are overly optimistic have worse health outcomes because they think everything's going to be okay and everything's not always going to be.
They
You
don't
can't
look
just do
into
it.
it and then they don't pay
Yeah,
attention. Whereas the people
yeah,
who are
yeah,
always worrying, they're always on going to the
yeah,
doctor. Is this okay? I found this little mark on my skin. Is this okay?
yeah,
Right? I mean,
exactly.
it is also, don't get me wrong, it's important to go to the doctor, but
Yeah,
sometimes like you don't want to excessively worry and you don't want to think nothing will happen to me.
right.
It's being in somewhere in the middle
Being
or
somewhere in
either.
the middle. Yeah. Where's your center? Where's your center might look a little different from someone, like if someone genetically predisposed to worry a lot, their center might still be a little high compared to someone,
Yes, because
but it
everyone's
might,
different.
yeah, yeah,
Okay.
yeah,
And how can we start to realize our full potential and become the best version of ourselves?
yeah. I'd love, I'd love to ask you that one. What do you think?
I believe it's not biased, but it's from experience. Somatic, like doing somatic processing,
Mm-hmm.
going in the body
Mm,
helps you discover yourself more.
mm,
You learn and you learn about your limited beliefs. Um, and I also believe it's important to give back to people,
mm,
especially people that are hurting.
mm,
And when we're on our own healing journey, we're able to be our better version of ourselves.
mm,
And then when we're helping ourselves with our healing journey, we're able to help others.
yeah.
And when we do the deep going into the body, doing the meditation, doing the somatic processing, we're becoming more attuned and more present with ourselves, and therefore we're able to be more present with others and be more aware of when someone's hurting. And when we experience trauma, it can lead us to be more compassionate and understanding and act with more grace towards other people.
Right.
Yeah.
I think I agree. So it can expand our capacity, right? And
Exactly. That's
yeah,
the word, expand our capacity. Because
right.
maybe we want to, but sometimes we have like sunglasses on,
Yeah,
or we have like a bag over our head. We can't see right. We can't see
yeah,
clearly. But with the more healing work we do, we're able to see clear and more perspectives as well. Because it's really important to be able to see different people's perspectives. Because when we can and really sit and listen to other people, especially people that are different than us, we can learn so much.
I agree. Yeah, right. And it can be we can end up kind of constricted or really narrow in our range sometimes. And and I think a lot of these healing practices, it sounds like, I mean, they help us expand a little more into who we are. Um, oftentimes people, I think, find after when they've gone through some of these healing practices is they feel more like themselves or more able to be themselves or more able to listen to other people, or they handle interpersonal stresses a little more gracefully, maybe. Um, yeah,
And our
our full potential.
relationships. Sorry, go ahead.
Well, I was going to say, I think reaching our full potential as humans, I think by definition, we end up doing better by other people and the world. I don't think it's like a purely selfish thing because, and um because it could seem that way, or it could seem like, I mean, I've been someone in the past, and I've known folks that work themselves into the ground, often including to help other people. Um, but sometimes, speaking for myself, when I was doing that, I actually wasn't helping people as well as I might have. The quality wasn't always there.
Right, because you don't have the energy.
You don't have the energy. So there's like, it's more of a perfunctory kind of performance of, and I know sometimes folks are in situations where they just have a lot to do and they just have to get it done, and they're working two jobs and they have kids and they have this and they have that, and that's sometimes it's just the way it is. But I think, and I've worked with folks in that situation where there's often still moments where you can find some breath and some presence and some sensation and some
And those
healing.
moments are so important. I know, because I
Yeah.
have a pretty busy life, and that's the advice I've been told multiple times. And
Mm.
people listening will be like, yep, is to take a few moments, even when you're busy. It doesn't matter how busy, because trust me, I'm very busy. But
Yeah.
take a few moments throughout the day and just go into the body.
Yeah.
Just notice what's happening in the body and be present with yourself a few times a day, and what a difference that will make. I know even last week my head was hurting,
Mm.
and it was hurting for a few weeks, but last week it was really hurting, like a lot of pressure. And I ran into an in-body processing session,
Mm.
and it became more present, the pressure on my head.
Mm.
And then by the end of the session, it went away. And this week it's been not really present, very, very minor. But it was just, it needed to be heard. Like it was saying, you're tired, you just need time.
Yeah, that's beautiful. I'm glad you found that. Yeah.
Yes.
Right.
So thank you.
Mhm.
And why is it so important for a therapist to be present, to be truly present to the client? And how is a therapist, for other therapists watching today, how can we start to become more present for our clients?
Yeah. Well, so there's this body of research in therapy called the Common Factors Research, which you may have heard of it, but it's basically the idea that in psychotherapy, a bit more important than the type of therapy you practice is that these common factors are present. And they include things like the therapeutic relationship, which is a emotional bond with the client, as well as agreeing on what the goals are and how we're going to get there. So it's like a combination. And then things like empathy, um, creating a sense of meaningfulness and hope, and the ability to repair ruptures. So if there's a issue in the relationship, being able to work through it. And some folks propose that presence is actually the hub. So if those other factors are kind of on a wheel, presence is central, meaning it's really hard to repair a rupture between psychotherapist and client if the therapist isn't fully present. And so what do we mean by present? There's different ways of defining it, but it can't really be defined, right? But it's Sherry Geller is a Canadian psychologist, and one of her, she writes a lot about presence. And her definition basically involves this process of the therapist being grounded in their body and and kind of using their body as an instrument. So in therapy, they're kind of sensing their body to some extent. They're aware of how things are registering with their body. They're not fixated or distracted by it, but there's some awareness of their own body, and they're grounded. So they're in a kind of somewhat regulated state. Then, so that's the body. Then she goes into emotion. The therapist is immersed in what's poignant. So this is kind of a humanistic therapy idea, but what's the deeper feeling behind what the client is saying? And we could be wrong, but I'm looking for the feeling and the emotion, right? Then she talks about our mind is expanded. So we are open-minded as much as possible in the room. And then the spirit of presence is that I'm with the client and I'm for them. Mm-hmm. So I'm not too detached. I'm not too dissociated or distracted, although all those things are going to happen for therapists. But here's the tricky thing is presence in psychotherapy is different from mindfulness meditation. Mindfulness meditation may be a way for many people to increase our capacity to be able to be present. But in order for presence in therapy to work, I have to express it to them. They have to know I'm present. I can't just be staring blankly at and that's going to look different based on the client's cultural identifications, my cultural identifications, a lot of factors in terms of how I express to the client that I'm really with them and for them. A lot of it is nonverbal, it's intuitive, it's energetic, right? It can't be just like a checklist of like, make eye contact 30% of the time and then
exactly. Oh, they're about moved. So we got to mirror them.
Yeah, there's no like it has to be kind of abstract because it's not a formula, you know. So it's like the idea basically is, can the client feel that I'm really with them and that I'm really for them, and I'm not so immersed in them that I'm literally as upset as they are, or I'm making it about myself, but I feel enough of what they do that they know that I'm with them. Of course, you know, so why is it important in therapy is, you know, lots of different forms of psychotherapy have talked about how this is kind of the central thing is people need someone to really be with them and really hear them. And, you know, some people want you to analyze them and give them interpretation. Some people want more talking. Some people want more embodiment, and some people want to look at the past, the present, the future, some, you know, blah, blah, blah. But they all are coming to you for this hour so that you're really there. But some of what my research showed is if you generally do pretty good with that as a therapist, like you have your own work you do, you figure out a way, whatever your style is, they know, your clients know you're really there with them. When you're struggling to really be there, like you're tired or you're a little dissociative or whatever, the client will likely pick up on that, but they'll cut you some slack and they'll appreciate the effort. It's like, so it's like, I think I say that because I think a lot of people get intimidated by this idea of presence, especially these days, because we know that most of us are very distracted. So the
Mhm.
idea of presence is kind of intimidating, and therapists find it intimidating. But it's basically, does your client know you're with them and for them? And can you, the last thing I should say about it is, in existential humanistic therapy, presence is often about what's unsaid, not always about what's said. So when the client, when the client's, let's say my client is feeling something, a very poignant emotion, and they tear up a little bit, and then they look away anxiously and start intellectualizing and going on some rant,
Mhm.
right? Um, that is a physical, emotional, mental, behavioral process, and maybe even a spiritual there's something going on there. And am I, can I hold that
Mhm.
in a way that the client picks up on that somehow energetically they know that I'm holding that just happened, like physically and emotionally and energetically. It could be the facial expressions I'm making at each stage. It could be, you know, I might say, oh, I noticed something just happened there. I was right there with you. Time seemed to slow down a little bit. It seemed very poignant. And now all of a sudden,
Right.
um,
And then sometimes when they do that, it can be like a resistance spark coming up. I don't want to
yeah,
feel that emotion. So they're going back
yes,
to their head.
yeah, exactly.
Right.
Yeah.
And I think it's so important. I think basically what you're saying
Mm.
is being genuine and actually caring about the client. And when you do, it will come
Yeah.
across and the
Yeah.
client will feel safe
Yes.
because that's
Safety, I think,
huge.
is a big part. I think safety is a big part of it. Presence. I mean, and that that could help us modulate our presence sometimes. So like if let's say I feel safe in therapy with my therapist during long moments of silence, I might have a client that does not feel safe. You know what I mean? Like so presence can be also, it can help you modulate how you create safety. So a lack of presence might be me imposing on the client. Like, I am a therapist that demands long periods of silence or something, and that is how I become present personally. But how I become present personally is not what presence in therapy is about. It's about how to invite the client into their own experience and how to incorporate the present moment experience of our relationship.
Exactly. And then when the client does that in session, becomes present with himself, they start become present outside of sessions as well, easier with themselves,
Yeah.
right?
Yeah.
And is that what you'd advise people if they're looking, how can they themselves, the client, become more present with their own body, their own self? Is just practicing in sessions, doing meditation. Is that what you advise, or?
Yeah, I would say I mean, I hesitate to just recommend meditation because I know for some people it can be triggering for them, or it can
Yes.
be, but I think if it's, as long as it's safe, I certainly think so. I guess one thing I would say is, in therapy, if a client wanted to cultivate presence in therapy, um, one way would be to sometimes, when they're talking to their therapist, sense their own body and notice that, or if it would help, ask the therapist if they could have a moment of, when the therapist asks a question, maybe ask if they can have a moment to feel that question, and really make an effort to not just respond too quickly, but to really see what they're feeling. I think that's I think that's one way. I think if someone's wanting to be more present, I think you're really onto something, that starting with trying to be more present in relationships, as long as you have some safe relationships, could be a great way to start, because sometimes it can be scary or boring or really hard to become present when one is by themselves.
I
It
know
can
I've
be,
been advised.
yeah.
Sorry, go ahead.
Well, no, please. Yeah.
I know I've been advised of a 3-year-old daughter,
Mm.
and to become more present, just to sit and stare at each other
Yeah.
for a few moments. Just look at each other's eyes, and even practicing at home with, even, it doesn't have to be a child, it could be your partner, and just literally sit there and stare at each other
Yeah.
and just feel each other's presence, their energy, and just notice what happens in your body.
That's beautiful. Yeah. I like that.
Thank you.
Yeah.
And so, from my understanding, you have worked at one of the world's leading mental health and addiction centers. Is that
Yes.
correct?
Yes, I have. I worked at Sierra Tucson for about 3 years. Yeah.
Okay. And what is the latest cutting edge advice you can give to people that are struggling with drug addictions?
Yeah. Well, I would say definitely get treatment, get support. Um, it can be very hard and dangerous in some cases to try to give up substances on your own. Sometimes folks do that, and there's a lot of physiological and mental, emotional pain that goes along with it. And sometimes old, if we want to call them demons, or some of the psychological, emotional, physiological reasons why you were using them to begin with, might even get stronger. People can be at risk of self-harm, and also if their tolerance for the substance goes down and then they give up at the last minute and go and use, they can overdose or die. And people overdose with substances besides opioids too. People can overdose on other substances. They could use even less, even if they try to use less methamphetamine than they had used in the past, it could still be too much for their vulnerable system, and they could go into a psychosis or something. So I would say get help. Now, if there's the possibility, I recommend integrative help. And I think one of the reasons why Sierra Tucson, located here in Arizona, made a big name for itself in the 80s and 90s, and there's other facilities here now too, like Sabino Recovery is another one, but there's this integrative model of mind, body, emotion, spirit. So there's a lot of different forms of psychotherapy. I was doing group dream work when I was at Sierra Tucson, and I also did some EMDR and some existential therapy and things. But then they also had cognitive behavior therapy and 12-step, and there's a wide range of options. But then there's also the massage therapy and yoga and acupuncture and exercise, and it's in a beautiful natural environment that can create that sense of awe and peacefulness, and so I would say looking at multiple areas of your life, and looking at the psychiatric, the physiological, I think that particularly folks with opioid addictions, if it's a serious opioid addiction, I recommend talking to a psychiatric provider that can at least explore medication options. But I don't recommend only relying on that. What I've seen in my experience is the medication-assisted treatment for opioid issues are very good at getting people off the stuff that could kill them, and very good at keeping people alive. And sometimes those places aren't as great as helping people thrive for various systemic reasons and financial reasons. So what can end up happening is, especially if folks have a lot of trauma on board, or a lot of generational trauma, and a lot of, they're facing a lot of cultural prejudices, there's systemic racism or different things they're dealing with, or heavy socioeconomic burdens.
And racism can be huge. And I don't think people are aware of that. It still exists very much today. I know even where I am living, it's not good.
Yeah, it's a big, right. So then it's like, if people have these multiple stressors, then the medication can keep them alive, but, finding their way to therapy and to a psychiatrist that can actually spend some time with them, that isn't just 8 minutes every 3 months. Here's your refill, but can actually talk to them about, you also have some social anxiety going on, and that's what this means, and here's how we could work with that, therapeutically. And so I mean, but that was all kind of, I think, to be succinct about it, there's this saying, and I forget who said it. It might have been Johann Hari, I think, who said the opposite of addiction is connection.
Yes,
and it's like,
I've heard that.
How are you connecting with yourself? What aspects of yourself can you connect with? What aspects can you not? Your strengths, your interests, everything. How are you connecting with other people? Who are you connecting with? Who do you want to be connecting with? And how are you connecting with the world? How are you connecting with the cosmological, how are you connecting with your existence or God or whatever, purpose, meaning. I would say, looking at those things, how am I connecting with myself, others, the world, and the bigger picture of your life on earth? And there are people and resources that want to support you in every area of that, in most places, at least, and so if you're contemplating getting help, there's also people out there that won't overly push you. I think sometimes people are contemplating, and then they're afraid if they go talk to someone, the person's just going to snatch them up and throw them into like a prison rehab or something.
Mhm.
And I think in many cases that's not what's going to happen.
So there's a lot of fear.
Yeah, I think there's a lot of fear, because it's the substance is the one thing that was helping them for a period of time, and maybe they're aware that it's not really doing its job anymore, but they're scared to give up that one thing.
And sometimes it's meeting unmet needs,
It's meeting
right?
unmet needs. Exactly.
Yes,
Yeah.
yes. And now my child's grandfather,
Yeah.
um, he he's passed away, but he had an opioid addiction. What
Mm.
advice do you have to families that are struggling and they have a loved one with an addiction?
Yeah. Well, and so if it's an opioid addiction, I do recommend, I can't just blanket recommend this. I mean, I'm not a psychiatrist, and also if I don't know the person, I can't make blanket recommendations.
No.
But right, but I could say I can recommend at least talking to an agency or a medical provider or a psychiatric provider if it's an opioid addiction, who can help with the medications that help with the opioid addiction, like the methadone and the Suboxone and those things. I worked at an agency that I think did a really honorable job at helping people. And again, I would also recommend, don't just do the medication in most cases. Some people who, here's what I've really found is, if someone had some positive things growing up, they had some type of positive influences, and they have some type of resource, uh, meaning some type of positive emotional support, some type of economic capacity, some type of confidence, if they have an opioid issue and they get on methadone or something like that, and maybe they go to a 12-step meeting some now and then, or do it seriously, preferably, or some other type of recovery group, that might very well be all they need to leave drugs behind and thrive in their life. My experience has been, the majority of people, though, that if you have a serious enough opioid addiction, in addition to medication, you're probably going to need like real deal psychotherapy, as well as many of those other things as can be afforded or mixed in,
Okay.
so I would recommend, if it's an opioid addiction, and then in general, if you have an addiction, I would recommend therapy, and I would recommend talking to a psychiatrist to see, and also the meetings, the support group meetings. But for families, I think it's very, very hard to, for a lot of families, it's very hard to be on this middle path of not either condemning or judging harshly or enabling. and those are very pathologizing sounding words, but whatever those
Be
phenomena
very difficult.
are, yeah, the middle path of kind of support, love, boundaries, and you're not alone with that. A lot of people try to do it alone. Both people with addictions and families of people with addictions try to do it alone, often out of shame. But it's like you don't have to reinvent the wheel. You're not the first person to have gone through these things. There are communities of experienced people that can help guide you.
And they're
And
not
they,
alone. There's many,
yeah,
many people that have gone through
there's
this.
many, many people. And the shame keeps people isolated. And then they try to reinvent the wheel and they make all the same mistakes that every human has ever made in that situation. And they could have been spared some of those mistakes if you just reach out and just take the step and go. So for families, there's Al-Anon, there's like the families for peoples with, and I definitely recommend if you have a child with an addiction, I think you should talk to a therapist yourself, because it's probably one of the most difficult things anyone could ever go through. It's like if your kid is struggling, that's it's and the therapist, if they're any good, they're not just going to blame you for everything. It's not, it's going to help you expand your capacity and access how you really want to deal with this, so that you're not just in reaction mode. And I'm enabling them because I don't want them to be on the streets, but I'm actually funding their addiction. Or F them, they need to learn it the hard way. I'm going to beat it out of them or whatever, the two extremes.
Mhm. Okay, well, thank you so much. And it just comes from a place of pain. We need to
Yeah.
remember that. It comes from a deep place of pain. Okay,
Yeah.
well, thank you very much. Thank you, everyone, for watching today. And thank you, Dr. Chris, for joining in. It was an honor to have you. We will be having Dr. Chris's information below, as well as my own. And if you're struggling or you know someone that's struggling, don't be afraid to reach out. We are here to help you.